Hi, everybody.
Hi.
Hi, it's Christine and Tina, ladies of the Lanai, and we're again out on our Lanai, and we're here with a special guest. It's sort of a you asked, we answered kind of a thing. We've had a few questions coming to us regarding healthcare in the villages, and so we have with us today a professional in that arena. And would you introduce yourself and tell us your title and what you do?
Sure. Hi, I'm Rebecca Brewer, and I'm a Medicare specialist or insurance specialist, healthcare specialist, and I'm an independent agent broker, and I work in the villages and a few other states as well.
Fabulous. Thanks so much for coming today.
Thank you for
Because we
having
did
me.
have a few questions about healthcare. And, people come here and they worry about where they're going to live or, how they're going to make friends or play golf, but they don't often really delve into the healthcare questions. So we're bringing Rebecca to you today for that. So, Tina, do you want to start?
Yeah, so when you first come down here, probably here or anywhere, but specifically the villages, what are some of the first things you should look for when you're changing your healthcare in the villages? If you're changing provider, coming down, are there certain things that a person should take into consideration as they're looking for that?
Well, it really is going to depend if they're going to be a snowbird or they're going to be a resident of Florida. And that's the first thing in the fact finding. And then if they're going to want to see their doctors back home or travel to another state, we take all of those things into consideration. And in order to go back and forth, most of the time you need a PPO or a Medicare supplement plan.
And what's a PPO?
The PPO is a preferred provider organization. So as long as the doctors are in network, you pay a lower copay. If they're out of network, you can still see them, but you just pay a higher copay.
Okay. Um,
Okay. And what if you aren't changing healthcare providers or insurance companies, but you still want to find new doctors?
So that's going to depend on your plan as well, whether or not the doctor's in network or they're accepting whatever insurance you currently have.
Mm-hmm. Okay. And the best way is that to go like on the website for your insurance company, or is it word of mouth, or is there another way that you think is the best way?
right. Like what is the best way to find your a new primary care physician?
You can go on your provider's website and put in your zip code, and it'll give you a radius. You can also call them for help, or if you have an agent here helping you, they can search for you as well.
And so that's something you would do?
Yes.
And what I as an individual would come to you. I don't have to be part of an organization to come to you.
No, you don't. And there's no charge for my services.
Oh,
That's
okay.
great.
And then what do you do if I came to you as a new client? Do you ask all these questions if they're a snowbird, if they're a resident, and I guess what their health care issues or
Right. It depends. The biggest issue is if you're under 65, it's a totally separate thing, or if you're already going to turn 65 or you're already on Medicare. So those are two different systems. So that's the first question to determine. If you're not 65 yet, then we go on the marketplace and search healthcare companies for you. And for a lot of people, it depends on the price and the benefits.
because that's something I mentioned to you that I'm going to have to do
Right.
By the end of the year, and it just seems very overwhelming. So I may be giving you a call.
It is.
To see what to do because I don't even know where to start.
Well, I have software where I can put in all your information, and if you have a primary care doctor, then I can pull up all the companies that are available here in Florida and then send you some quotes, and then you can make a decision that's right for you.
Great.
And I was just going to jump back to when I was on my own finding a primary care physician without your help, like I can do it myself. I didn't even realize that that's what someone like you could do. Is I looked at what was in network, and then I looked at reviews.
Correct.
But that was all else I knew what to do.
And some people use that neighborhood next door neighbor or one of the villages Facebook groups and ask questions. And in those, a lot of times in those groups, there's the little magnifying glass. So you just can go up there. You can put primary care or cardiologist, and you can see all the discussions that have been asked already with
Mhm.
that
Okay.
question and start searching through it. And, you know, one thing I find important is to read the comments
Yeah.
because that's where the nuggets are in
Mhm.
the comments.
Right.
Mhm.
I agree because you always, whether you're looking at any kind of review, you want to see the good and the bad. Like, what are people complaining about?
Yeah.
Correct.
Yeah.
That's
And
good
sometimes
advice.
if it's all good online, then it's fishy. Something
Exactly.
fishy about it.
Suspicious.
Mhm.
Right. Okay. Now, so how easy is it to find doctors and specialists inside the bubble versus outside the bubble? Can you talk about that a little bit?
Um, well, I think it's fairly easy. Like I have a list of different types of doctors, just because I work in the villages. So I have lists of who the good ones are, and then I'll send people, you know, the names, the list, and then they can call around or they can do their own reviews based off of that
Yeah.
and choose. But, you know, they're still servicing the villages, but they may be just right outside in Leesburg, you know, not
Mhm.
exactly. It might not be golf cart
Yeah.
accessible,
Right.
but it's very close.
That's what ended up when I got a new gynecologist. I ended up in Leesburg because the other thing was they may not be taking new patients, so
Correct.
you
Yep.
could be helpful, you know, with
Right.
that instead of making 10 phone calls. Like I was making all these phone calls, and they're like,
Waiting for a call
"Yes,
back.
Right.
sorry, no new patient."
Yes,
Yeah.
that could be difficult. The other thing is they may be way far booked out.
Oh, that's right.
So that can be a problem with a specialist. So a neighbor of mine has a ripped Achilles, and
Oy.
she didn't have a specialist, so I gave her a list, and she called one, and she was able to get right in by Brownwood. So
That's great.
it worked out great.
Okay,
She's not even my client,
you're
so
just a good friend.
I am. I just want to help people.
What would you say, just in your experience of doing what you've been doing here? What's the biggest challenge for healthcare for a new villager when they move down here, besides being totally overwhelmed?
That's the biggest thing is overwhelm, not knowing where to start, where to look, because you know they're in a new place, they're getting to know the lay of the land, and they don't even know where to start, or
Yeah.
if somebody's going to accept their insurance, if they need to change.
Mhm.
Um, it depends on their age and their health as well. I had a person come in and see me the other day, and they're from Ohio, and they thought their plan was fine because they could use it here in an emergency, but the husband has become very sick, and they realize now they need to change to a PPO so that they can use doctors here outside of emergency.
Mhm. So speaking of change, when can you, I know that there's an open enrollment and there may be other times
Right.
when you can change. You can't just change whenever you want,
Correct.
right? When are those times when you can change?
And before you answer, is that only for Medicare or is that for any insurance?
Um, well, if you move here and you're a new Florida resident, you know, you moved outside of your area, then you have a special election period. So we can enroll you. All right. For Medicare, there's an AEP, which is October 15th through December 7th. And then there's another election period called an OEP, and that's from January 1st to March 31st. And it just depends on what kind of plan you're on when you can change. And then for the under 65, it's um, like November 1st through December 31st. So,
Or when you lose your insurance,
oh,
right?
yes, if you lose your
Because
insurance.
I was going to say, oh no, then that means that you have to wait till November. But no, if she loses her insurance because Cobra runs
I'm not
out,
on Cobra.
you're just paying.
They're just
Yeah.
providing
Yeah,
it.
it's
Oh,
being
they're just providing.
provided
But when that
until the
runs
end of the
out, she
year.
can change
Right. So
too.
if you have a life-changing event like a baby, a move, a job loss, a loss of insurance, maybe even your income changes,
Oh.
a lot of different things can trigger a special election period, as well as weather and different things. Like last year, we had a special election in Florida the whole year because of all the hurricanes and things.
Oh wow.
Hmm. And I think we have one right now due to this Israel and Gaza thing.
Oh,
And
Imagine that.
and Georgia had one for when Rosalind Carter passed away. They had a special election period for
Oh my
that.
God.
so no one would know that unless they
No.
had someone like you on their
Right.
side.
I didn't even know that there were periods where you could or couldn't do any. Because, well, I worked for the same company.
And
for
you didn't
almost
have to worry
25
about
years.
it.
Yeah.
Right.
So,
Good information. Yeah.
you want to talk about the next one, or?
So yeah, you can ask about the hospital.
Yeah. Is it true there's only one hospital in the villages?
There's actually 2 hospitals in the villages, and then there's a couple in Leesburg and 2 or 3 in Ocala.
And is there a preference of any of them over the other?
Well, in Leesburg they have Orlando Health.
Mhm.
They have a much higher rating than UF Health, which is in the villages. And I know that in the villages the problem with is staffing, because of the proximity of where people have to live to get to work, and if they're
Right.
not living in the villages. So staffing has been, I think, an issue for them, but they're working on it. That's why they were building Middleton
Yeah.
and doing all of that so that for younger workers they have a place to live and for their children to go to school.
Yeah, and on that subject, there was going to be a big health center down in the Middleton area. I tell me if this is true. I heard it's sort of um, on hold or in a holding pattern, at least at the moment, but it's still going to hopefully go forward. Is that correct, Marla?
It's my understanding they're going to build a new hospital there, and they are going to have a care center just like they do it in, every few miles.
Yeah.
With all the primary and some specialists there for the village's health.
Yeah. On the subject of the village's hospital, I did have to go there for an emergency reason, and I was well taken care of, I'm happy to say. I know that there's opinions on both sides,
Correct.
but I will tell you that I had a very good experience.
And and that's very subjective because some people like a certain doctor or the care they received and others don't. So
Yeah.
Mhm.
it's a hard thing, but I have heard a lot of complaints about the hospital
Yeah.
and the emergency room.
Yeah.
I went to an emergency room recently.
Did you go to the ER or did you go to urgent care?
No, it wasn't urgent care. It was
The
the
ER.
Emergency
the
room.
emergency room.
Oh, and
Because I was going to go to urgent care, and Nellie was like, "No, you don't go to urgent care. You go to the emergency room."
how did it go?
Because it went well. I thought they did well. And the interesting thing is before they discharged me, he's like, did we rush you? Are you both?" Like, he asked me all these questions to make sure that I felt I was taken care of.
Mhm.
And I felt they saw me pretty fast, but I told you the stupid reason why I ended up.
Why don't you tell our listeners why you wound up in the ER?
I accidentally took my dog's medication instead of my own in the morning, and it happened to be 3 different types of pills. And
Oh, you took 3 pills?
yes.
I thought you took 1
Because
pill.
I have it in like a pill thing, and I
Oh,
was
no.
talking on the phone, which I shouldn't be early in the morning, and I just popped it in my mouth, and as soon as I swallowed, I was like, crap, that's my dog's. And then I called the vet because I didn't know who to call, and they're like, "Oh, 2 of these are toxic for humans," so they're like, "Go to the emergency room and see what they say."
Oh, my.
I could have called you. No.
Poison control.
I would think
That's
poison
the
control.
emergency room called poison control.
Yeah,
to
that's
double check.
yes,
everything, so.
yes. On that subject, our dog, our grand dog, we think got one of our medications. We weren't really sure, and we took him to the 24-hour vet, and they did the same thing. They call poison control before they do anything. They're
Mhm.
like the umbrella for if you accidentally ingest something.
Yeah.
Well, people of my age anyway know about poison control because when our kids were little, I don't even know if we had the little locky things for the cabinets, where kids could
No, we did not have
get into stuff, right?
We did not have them. No, we didn't.
So it was really pounded in our brains.
Yeah.
To have the number of poison control right available.
All right. So the next question that we had for you, Becky, is regarding those that are not on Medicare yet, which we definitely have touched upon, and close to 65, but also for those on Tricare. Can you talk a little bit about Tricare and if you're on it, even what it is?
Yes, because I don't know what Tricare is.
Sure. Tricare is it's Tricare for life. It's for people that are retired from the military and their spouse, and the Tricare acts as the Medicare supplement, so they use original Medicare, and then Tricare picks up the balance. So it's some of the best insurance you can ever have, and they provide the drugs for you as well. They don't have some of the extra benefits. So if you're at the age of 65, a lot of times they go on an Advantage plan so they can have the dental and the vision and the hearing and some of the over-the-counter or even a money-back plan. And they still can use their Tricare. I show them how to coordinate the benefits with the plan. So there's also Champ VA, which is a military for spouses. And then there's Tricare that's under 65 where they're not using their Medicare yet. And I don't know a lot about it, just that people here in the villages have had a few problems finding doctors that are in the Tricare network under 65.
And does that also go with like the Veterans Hospital, their service?
Tricare is
totally
not,
different?
it's totally different. There's VA eligible. That means they were disabled in the military, and it depends on what they pay at the doctors or the facility for at the VA based off of what their disability percentage is.
So to me, it's all very confusing. So
Mhm.
I think having someone like you explain, like if I walked in and
Yeah.
said, "This is my situation. This is what I'm looking for,"
Right.
like someone to help guide me through, because
Yeah.
oh my God,
There's so many
There's
variables.
a lot
Yeah.
of variables. And we do have a lot of military down here in the villages. So
Mhm.
a lot that would apply to
Right.
that question.
Do you have advice or tips for people who are approaching the age of Medicare? Like, is there something you need to do to prepare to go to Medicare? Medicare? Anything special? Or
So, I
like
mean,
if you're 62, 63?
not so much at that age. I just want to mention that there's something called an IRMAA, and the IRMAA is, it's kind of like the penalty. You pay more for original Medicare if you take a big distribution. So Medicare has a 2-year look back period. So if I had one clients, they took money out of their 401k and bought a motorhome, which caused their income, because that's earned income, right? And you have to claim it on your taxes. And Medicare looks back 2 years when you turn 65. So whatever your income was then, if it's over a certain amount, is the amount they're going to charge you. So you just be careful about your expenditures a couple years before what, to see what tax rate you're in. And there's a sheet that I can give people. Depends on if you're single or filing married together.
Mm-hmm.
So again, go approaching those 2 years to make sure your income is under, because that's like the premium that you pay.
Correct.
That's how they determine.
Yeah,
the
most
premium?
people are at the normal premium, which is about $167 right now. And every year it changes. And every year they raise the amount that you can make, because of the cost of living. So there's a lot of variables in that. So I just caution people when they're retiring, leaving their job, make sure you roll over your money. Don't take big distributions, that's going to put you over that amount.
Mm-hmm.
That's good to know.
Yeah. Good information. Yeah. And what about some of the other things specifically? Are these things covered on Medicare, like emergency services, dental, vision, hearing, OTC? Can you talk about those?
Sure.
Little
So
extras.
original Medicare, Part A covers hospital, and Part B covers outpatient services like doctors, outpatient surgery, MRIs, all your blood work, your tests, and things like that. So you have a choice when you turn 65 to stay on original Medicare and just have that only and get a standalone drug plan. Or you can stay on original Medicare, get a supplement to pick up the other 20% that Medicare doesn't cover, and get a standalone drug plan, and you pay an extra premium for that coverage. Or you can go on a Medicare Advantage, and most of those are zero premium. Yeah. And Medicare does not cover dental, vision, or hearing. They only cover, as far as vision goes, diseases of the eye, like cataract surgery, glaucoma, and those types of things. And they only cover one pair of glasses after cataract surgery. So they don't really cover, preventative or, routine vision, and they don't cover dental at all. So with the Medicare Advantage plans, you get some extras. You get the dental, you get vision, you get hearing, you get over the counter. Some have transportation, some have money back, some have food cards. Just depends on your health conditions and what you qualify for.
Wow.
If you're not on Medicare, like I'm on my regular insurance, whatever.
Commercial insurance.
Yes, commercial insurance.
Yeah.
What do you think of the discount pharmacy, like Amazon Pharmacy or Good RX or things like that? Like, are those really beneficial?
A lot of times they can be. I tell all my clients to download GoodRx, and before they pick up a prescription, check it with GoodRx, and that'll tell them about what the price range is going to be, and then they can compare it when they get to the pharmacy or if they go on Amazon. And the other thing I always tell them is, you can't call me after you pick up a prescription and just said, they just charged me $350 for this, because there's nothing I can do about it once you pick it up and pay for it, right?
Yeah.
So I always tell them, if you go to pick something up and you think it's way expensive, just say, hold on to it, I'll be back for it, and call me so I can look it up and find alternatives
That's a great
and help
tip.
you.
That's a wonderful tip.
So if you're my agent, what are some of the things besides that you can fight for me or advise me on or guide me, like little things like that, not just like a big picture of a plan or this or that, but like little things that I wouldn't even think to call you.
So like, I know the least expensive place to get eyeglasses from, that is one of the biggest manufacturers. They manufacture all the real big names of glasses.
We'll wait for people to call you to get that information. We're not going to tell you now.
Just, advice on doctors if they're having problems with their plan.
What if they can't get an appointment with a doctor? Would they call you? Can you help with that? Or
yes, it depends on where they're getting their health care from. But if they're using Villages Health, I have a lot of pull there. So I have helped people who had an appointment with a specialist tomorrow and didn't have the referral get in, and they called me sobbing uncontrollably that they were having a cancer rebound and our problem again, and that this was just more than they could handle. And I just want to take that off of their plate and make.
You must get a lot of flowers and gifts and things like that.
No, but I promise these things to people, and I want to follow through with my promises.
I didn't realize that that's what an agent could. I just thought they get you a plan and that's it.
I have a feeling you might be going a little over and above.
I do.
Yeah,
I do. Not every agent is like that. But you know what? The worst thing is, I don't want my seniors to lose sleep over something that they think is not covered, or it's going to cost them this much. I just try to tell people, you don't know what you don't know. Just call me. I'll get it worked out. I promise you.
I like that.
We talked about Medicare supplement versus Advantage. We talked about that already.
So Advantage plans are probably a lot easier here in Florida. We have some very generous plans here that the co-pays and the maximum out of pocket are quite low. So when you compare that to what the premium is going to be in a supplement, sometimes it's just a moot point. There's and there's going to be some changes in 2025. We'll yet to see what they are, but it's going to.
What kind are coming?
But aren't there always changes?
Yes, every year.
Every year there's changes.
And we can't talk about them ahead of time, and we have to wait for CMS to release the final rules, and then we start talking about them. So October 1st is the first day we can start talking about the changes.
Oh, wow.
Oh, maybe we'll have her back on October
I know.
2nd. Good.
Is there anything else? Any other advice you could give to?
Yeah, anything we didn't
someone?
cover maybe?
Yeah.
Like we don't know what we don't know?
Yeah. Well, you know, a lot of people will give you advice, neighbors, relatives, a name of a company that they've used that they think is good. You'll see a commercial on TV. And my advice is not to take advice from those people, is to get a professional, get an agent, somebody who knows what they're talking about and knows the lay of the land and the plans. When you go with somebody who's not independent like me, I carry most of all the name brand companies and a lot of the smaller ones. And so I can compare all those plans. If I just work for one company, then that's all I can talk about.
Right.
So wouldn't it be better for you to have options rather than be locked into one company and that's all they're going to talk to you about, and have an agent that each year can review your plan and your drugs and advise you?
Yeah.
And how long have you been doing this?
Over 25 years.
And how long have you been doing it in the villages?
Well, I've only lived here 2 years, so 2 years, but I am licensed in many other states. I came from Georgia. I have a big book there, and in South Carolina as well. Tennessee, Michigan, some
So
other
you can
states.
help.
Could you try again?
Is that me? I didn't even know I ever had Siri. Siri has been eavesdropping without me knowing.
So you can help people find not only in the villages, but whatever state you're licensed in.
Correct. So like this lady that came in that I referenced earlier about her husband is in Ohio and they're on a plan, but they were on an HMO. So I would simply find the doctors she has there, what doctors they're using here now, make sure that whatever plan I change her to, both places accept the doctors in each state.
That would be most people's concern, wouldn't it? Yeah.
Right.
Trying to think if there's any other kind of pitfalls or common question. Are there like common questions that people come in and ask you that we haven't covered, like when they first come in?
Well, I think the biggest one is, is their health care going to work here? Do they need to change? How can they find a doctor? You know, who's the best specialist, just based off of their health conditions.
And it's a lot. And so someone like you basically helps them navigate and sort of triage. Okay, here's where we start, and this is where we go. This is where we go. Speaking of going,
Yes,
there went
my
the
dog
camera.
moved the camera.
So yeah.
So I just try to ease that anxiety and help them through.
Yeah.
And then just the fact that they know that they can call me anytime, that they have questions or concerns or an issue, that I can help them through it. And usually after the first year or so, they're good and they become, not as much anxiety.
Because again, I mean, we've talked about when you first move to the villages, everything is new. So you're getting settled in your house, you're making new friends, you're doing all that, and then like to deal with healthcare. For me, I kind of put it on the back burner because
it's not as much fun.
Well, it's not as much fun, but I don't have like an outstanding issue like that. Like if I had a special problem,
right? Like you're a diabetic or something.
That would be what I would tackle immediately.
Right.
But you kind of put it on the back burner. But just knowing that there's someone to guide you again really is
right. And I help
makes
people
me feel better.
Get their diabetic supplies mailed right to their house if they want to do mail order prescriptions, or they want to get them like at Publix or CVS. So just a lot of little things. The apps that you can download on your phone from the carriers that help you navigate your over-the-counter money. There's just a lot of little nuances that people don't realize.
Okay, great. So if people wanted to get in touch with you, we'll put all your information down below in the description. But if you want to just tell us now, what's the best way to get in touch with you, Rebecca?
Well, my cell number is 803-614-8330, and my email address is REB, Brewer, BREWER @gmail.com.
great, because I think people will be.
Do you have a website or anything? Or?
I don't.
Okay.
Because I just find that confuses people more. They just start looking and getting more confused. So
I can see
I
that.
feel like the easiest thing is to make an appointment, even if we just going to do it over the phone. I have people calling me before they move here so that I can navigate with them and ease their nerves before they get here
That's smart.
and get things set up before they even get
So
here.
you could do things on the phone, in their home, or in your office.
Yes,
all 3 ways.
You make house calls?
I do.
Oh, wow.
Can you find a doctor that makes house calls? No, probably not. But anyway.
That was Marcus Welby.
I remember that name.
Yeah.
Okay, well,
so I think
that was very informative.
Yeah, I think it's going to be very valuable to our listeners. And we hope you found our content interesting and valuable to yourself today. And if you did, please don't forget to like and subscribe and share this video with others, because that makes us, feel like we're doing the right thing. We're on the right track for you guys, and we really appreciate it.
Great.
Thank you for inviting me.
Thank you.
Thank you.